Hey guys, this is Dr. Hub. Today we'll look at the acute phase reactions, acute phase reactants, and also their functions. So to begin with, first the positive acute phase proteins. The positive acute phase proteins. So first we'll see the proteins as well as the immune cell function. So to begin with, the C-reactive protein. The C-reactive protein, the immune function is the opsonin. The opsonin on the microbes. Next comes the serum amyloid P component. The serum amyloid P component. So here the immune cell system function is going to be opsonin. Next, the serum amyloid A. Serum amyloid A. So this will be the recruitment of the immune cells. So recruitment of the immune cells, and this is to the inflammatory sites. And also it involves the induction of the enzymes. So there's induction of the enzymes that degrade the extracellular matrix. Next we'll be looking at the complement factors. So complement factors, it involves the opsonization, then there is also lysis, there is clumping, there is clumping of the target cells as well as the chemotaxis. Then we look at the mannan binding lectin. The mannan binding lectin. So here it involves the mannan binding lectin pathway. This is of the complement activation Next, there is also we will look at the fibrinogen, prothrombin, factor VIII, as well as the von Willebrand factor. So the immune system function, it involves the coagulation factors as well as the trapping invading the microbes. The trapping invading the microbes, and this is in blood clots. Next, there is also the some can cause the chemotaxis as well as the fibrinogen. They bind to the red cells. So the fibrinogen binds to the red cells and induce the roll-like formation. Next, we'll look at the plasminogen activation inhibitor. The plasminogen activation inhibitor. So in short, it is known as a PAI-1. So here there is prevention. It prevents the degradation of blood clots, and this is by inhibiting the plasminogen. Inhibits the plasminogen. Then comes the alpha-2 macroglobin. So alpha-2 macroglobin, it is the inhibitor of the coagulation. It is an inhibitor of coagulation. It is by inhibiting the thrombin. inhibits the thrombin. Next is inhibitor of fibrinolysis. The inhibitor of fibrinolysis, and this is by inhibiting plasmin. There is inhibition of the plasmin. Next comes the ferritin. In ferritin, it binds iron. There is binding of iron, and there is also inhibiting the microbiome uptake. Inhibiting the microbiome uptake. Then we look at the hepcidin. So in terms of hepcidin, there is stimulates the internalization of the ferroportin. It stimulates the internalization of the ferroportin and prevents the release of iron, and prevents the release of iron, and it is bound by ferritin. Bound by the ferritin, and this is within. This will be within the intestinal enterocytes and the macrophages. Next we look at the ceruloplasmin. So in terms of the ceruloplasmin, it oxidizes iron. So it oxidizes iron. Then it also facilitates for the ferritin, and there is inhibition for the microbiome uptake. Microbiome uptake. Then comes the haptoglobin. So in terms of haptoglobin, it binds to hemoglobin. So it binds to the hemoglobin, and it inhibits the microbes. Ion uptake. Then comes the orosomucoid. That is nothing but the alpha-1 acid. So alpha-1 acid, glycoprotein AGV. So it is pertaining the steroid carrier. Then we look at the alpha-1 antitrypsin. So here the immune system function will be the serpin, as well as it downregulates the inflammation. Next comes the alpha-1. This is going to be the anti-chymotrypsin, and this involves the serpin, as well as this also downregulates the inflammation. Lastly, there is a thrombopoietin. So this results in the thrombocytosis.